Assalamu alaikum. In this video, I'm discussing about the post-viral cerebellitis video stations. Once it comes on history also. So same post-viral cerebellitis. The description of video how would like be? It will be like a child is walking. The child is on unsteady, unbalanced gait, searching for balance, tends to fall. He has intentional movement, like abnormal movement when to start move. And also there will be general condition like skin rash. They can show that previously the child suffering skin rash. So again, I am telling the descriptions that I can see a child that is walking in unsteady, unbalanced gait, searching for balance, tends to fall. There's intentional movement, abnormal movement when start to move, and there is rash present. Also normal weight, height, everything we will tell and surroundings. Now it is a case of unsteady gait. What are the DD? We can keep acute and chronic case. If it is acute like post-varicella cerebellitis, any drugs, labyrinthitis, acute disseminated encephalomyelitis, Guillain-Barré syndrome, Miller-Fisher type, and any trauma, that is acute cause. And chronic like cerebral palsy, Friedreich ataxia, ataxia telangiectasia, Wilson disease, vitamin deficiency. So unbalanced gait, imbalanced gait, acute and chronic, acute and post-viral cerebellitis, trauma, Guillain-Barré syndrome, then what are the acute cause? Drugs, labyrinthitis, these are. And chronic like cerebral palsy, Friedreich ataxia, ataxia telangiectasia, Wilson and vitamin deficiency. Now what are the history we ask? So all the DD and the main diagnosis you keep in your mind. First onset, course and durations, when it started, how long he is suffering the conditions, what make it better and what make it worse. Then history of any preceding viral infection, like any skin rash on the body. So history of any preceding viral infection, skin rash on the body, any cranial nerve affections, any history of any headache, vomiting, especially at morning, and other sign of increase in intracranial pressure. Any ear pain, any change in behavior, any history of any chronic illness or immunodeficiency, history of any trauma, drug intake, so any history of similar conditions, and developmental history of school performance. So all the DD we covered. First of all, viral cerebellitis we keep. So before any skin rash present or not, the drug we keep. So history of any trauma and drug intake. Trauma also one of the DD we keep. Any chronic illness, SCP, Friedreich ataxia, ataxia telangiectasia we keep on DD. So any chronic illness, any change in behavior, and also sign of increased intracranial pressures. Now, what examination I will do? As usual, the assess the airway, breathing and circulation, ABC, hydration status, and conscious level. Then I will do the full neurological examination, especially test for coordinations. I will also examine the cranial nerve, especially the 5, 7, and 8. Examine the eye for any telangiectasia. I will assess the speech pattern, if there is any staccato speech or not. Examine the skin to rash any scar for old rash. So mainly ABC, vitals, consciousness status, neurology examination, cranial nerve examinations, speech examinations, eye examinations, and the rash examination, general examination. These are. Now, what investigation we will do? So, acute viral cerebellitis, what investigation? Remember, it is a case of post-varicella cerebellitis, so no need for investigation. No. If there is a rash in the video, and this is obvious case of post-viral cerebellitis, but if there is other cause or if did not improve after 48 hours or deteriorated. So if there is no investigation needed because it will improve after 48 hours, but if not improving, then we go for the full blood count, CRP for infections if still present, viral serology, toxicology screening, if suspected drug intake, antiepileptic like phenytoin. Then lumbar puncture if there is evidence of any infection, unless there is any contraindications. Brain imaging, MRI after discussion with consultant. So mainly no investigation needed after 48 hours if not improved. What is the management plan of post-viral cerebellitis? In case of post-viral cerebellitis, usually resolves spontaneously, does not require treatment. I will involve the multidisciplinary team like neurologist, SALT, speech and language therapist, social worker, family support, school psychologist. I will give advice to mom for ataxia at home to make sure that home is safe and need to supervise the child all the time. Most of the child will completely improve from ataxia in 2 to 3 weeks with no problem in walking. So management is that it is improved in a time. Multidisciplinary team will involve like neurologist, physiotherapist, speech and language therapist, social worker, family support, psychological support, lies with the school. And ataxia home safety will ensure we talk with mother that the child cannot be hurt, can fall down anywhere. Then it will be improved 2 to 3 weeks with no problem. When to seek medical advice, and also for insurity with some red flags seek medical advice. We tell like when the child not improve after 2 weeks. So after 2 weeks, it is not improving. If ataxia return after it has gone away, if the child develop high grade fever, become confused, irritable, if developed abnormal movement, if developed severe neck pain with fever, severe headache, If condition is severe, not improved, after discussion with consultant, may advise to start IV immunoglobulin or plasmapheresis. Okay. So if not 2 weeks, it's not improving. One ataxia gone, again come back, high fever, giving treatment, not improving, and condition getting severe. Is there any severe neck pain, fever, severe headache? These are. So this is so how it comes in exam task. Postviral cerebellitis. Kids is playing with Lego. Poor coordinations. Dysdiagokinesia, dysmetria, healed varicella, rash or scar. So in exam there is a rash. They show first. Then there is kids playing with Lego. Poor coordinations. Dysdiagokinesia. So his coordination is imbalance. Coordination, we know that in lower limb that is heel shin test and upper limb that it is the gynecomastia finger nose test. And on history, how it comes, suppose Jenny is a 3-year-old referred from the GP for acute unsteady gait, progressive over last 1 week. He had a fever and a rash 2 weeks ago. Take history from mom, Linda. So that is clear. 2 weeks ago there is rash, now unsteady acute case. So it is a post-viral cerebellitis, and we give the DD acute like post-varicella cerebellitis, drugs, labyrinthitis, acute disseminated encephalomyelitis, GBS, and trauma. So thank you.